They say you can't remember pain. I imagine this happens to everybody most of the time. When you go in for a swim in the ocean, you come out and it's a bit stingy. But if I go in there and I'm a bit flared, I come out of the ocean and it can be like razor blade cuts.
Julia, my name is Martina.
Mi nombre es Jimena Pinzón.
I live in Utah of the United States. I developed eczema when I was 6 years old, and as I got older, it progressively got worse. This is one of my worst days. It was when I woke up and my skin was really dry on my face, and it was so dry that I couldn't even open my mouth or blink, and it was very painful.
Eczema is definitely a debilitating condition.
You have to go down
in the direction of the hair.
Otherwise they form puslets.
每一朝起身嘅時候咧，我對眼都係會擘唔大啦，手腳係伸唔直，甚至乎係連啲手指關節都係會滲水滲血嘅。咁我家姐其實佢
Največkrat okrog oči imam take otekle, potem okrog ustnic, tukaj zadaj, tale okrog ušesa, zadaj za ušesom in pa seveda moj vrat.
My name is Rachel Ogola, and I'm Asen's mom. I remember going to the clinic and then I was told he has eczema. Then there was a lot of confusion, seeking medical help from one dermatologist to another. We moved all over the country trying to get him help. I've done everything in my power to try get information, to try also to get him a relief.
Eczema in the family, it's always a different dynamic. My mother has been definitely my rock. She actually blames herself about my skin condition. Now, having kids of my own, I can see where she's coming from. My little girl's 4, and she's slowly understanding that Dad's got sore skin.
Tengo un episodio bastante fuerte que es con mi hijo. Cuando él intentaba abrazarme, yo no lo permitía porque la dermatitis me generaba dolor, bastante dolor. Entonces yo siempre generaba un rechazo, digamos, con él porque me dolía mucho el cuerpo.
My relationship with my husband, we have no intim, because I feel very ugly. And he also cannot sleep whole night because I was scratching. So I know that my husband Uroš really loved me because I don't look perfect like a model. He really loves me. My inside of me. This is true love. I'm very lucky.
I've been playing table tennis for 5 years. It makes me feel good. I have won many awards and trophies.
What I realized, if you don't take care of the child's self-esteem, then it is going to be very difficult, especially at an early age. So with Asen, we really work on his self-esteem. We show him that he's just as good as any other person and that it is not wrong to be sick.
Los estigmas van direccionados a qué es lo que usted tiene, usted eso se puede prender, qué feo que se le ve su piel.
You have thoughts like I don't fit in, or people are staring at my skin, or sometimes you just, like, even I was at a point where I was like, I don't even want to be here anymore.
Yeah, your soul, it wears thin, you know? And they're the times where you would like to just lie down and not feel anymore.
El ser humano es una conexión, ¿no? Es mente, cuerpo y mente. Si mi cuerpo no funciona, mi mente pues tampoco.
Eczema isn't just a rash on our skin. It's not just a little itch on our back. It affects everything. One of the biggest things for me was my dog, Bandit. He always knew when I was having a hard time with my skin.
Yes, good.
And he would always come and sit by me and try to make me feel better.
喺香港嘅政策方面，其實我覺得幫助濕疹嘅政策其實好少，甚至乎係冇乜啦。因為公營嘅醫療其實對於我哋普通嘅市民嚟講，其實要負擔咁昂貴嘅開支其實好困難。因為講緊單正常嘅生物製劑喺而家香港都要成7500蚊一支，仲要講緊係一個月要打2支，即係講緊15000蚊。咁正常一個打工仔可能
Access to medications for eczema is a major issue. The government here in New Zealand still aren't making these drugs available and subsidised for people. To buy one injection, it will cost me $615 a week.
It is a chronic illness that needs to be treated as such. And when it is on that category, it's going to be easier to access medication, to access, even if not free, but affordable treatment.
We don't realise that our skin is our barrier to this world. You know, you just take it for granted, really. But it is, it stops everything.
I suffer from atopic eczema, and I need your help.
My skin itches, my skin swells.
Siento 1000 insectos que me muerden al mismo tiempo.
My skin hurts, my skin bleeds.
甚至乎好似俾火燒咁。
At times my skin has made my life
unbearable.
Estoy cansada de que me traten como si esto fuera una enfermedad contagiosa.
And I'm tired of
Feeling isolated.
And alone.
I'm tired of being asked why I'm not in school.
我都好厭倦啲人問我點解成日都揾唔到工作做，或者介紹工俾我。
I'm tired of being strong.
And sometimes I'm tired of being alive.
Estoy cansada de no poder acceder a tratamientos eficaces y rápidos.
Our lives can be better. You can make it better.
所以我邀請你，全世界嘅決策者行動起嚟。
If there are treatments,
Make it possible for people to access them.
If support systems are in place,
Make it so people can actually use them.
如果你關懷，
Make it so people
can get the care they need.
Do something right now. You have the power to change our lives.
Hi everyone, welcome to the EAA and EANZ live Q&A webinar on eczema treatments, the tried, the true and the new. My name is Betsy Brandon and I'm a Corporate Membership Officer. Thank you for taking the time to join us today for the EAA and EANZ last webinar for 2023. We hope you learned some great tips, information and resources for how to effectively manage eczema either for yourself or your loved ones, including new up-and-coming eczema treatments in Australia and in New Zealand. To begin, I'd like to introduce you to our panellists for the day, our EANZ representative and eczema carer, Vanessa Jenkins, her husband and eczema warrior, Reese Jenkins, our EAA and EANZ president and eczema sufferer, Cheryl Talent, as well as healthcare professional, Dr. Kate D'Ambrosis. Our fantastic panellists will be providing you with insights into eczema and the new treatments currently available in this space, the history and diversity of treatments in Australia and New Zealand, as well as some tips on how to navigate the condition, both as a sufferer and a carer. First up in today's session, we hear insights from Dr. D'Ambrosis on eczema management, various treatment options currently available, and even a short testimonial before we head into the Q&A session. If you have any questions while the panellists are presenting, please be sure to write your questions in the chat on your control panel. We will then respond to as many of these questions we can in our Q&A time. If we run out of time and are unable to answer your questions, please send them through via email or give the EAA a call. Our details are on our website. We hope you learn a lot from today's session, and we welcome, we'd also like to take a moment to say thank you to our corporate partners who always donate, give back and support our organisation. We wouldn't be able to do what we do without you. We hope you learn a lot from today's session, and we welcome any feedback post-webinar. So feel free to reach out if you have any topics you'd like to see the EAA experts talk about in our next webinar. And remember, there are goodies up for grab for those listening in today. But more about this later. I will now be handing over to Dr. Kate D'Ambrosis. Take it away.
Thanks so much, Betsy, and thank you so much to EAA for having me to talk today. It's truly an honour to be a part of their board and also a part of these talks, which are such a great initiative. They're doing fabulous work in this eczema space. So I've been asked to speak quite briefly. I apologise, I have to run off, but briefly on the management of atopic dermatitis in 2023. So I thought I'd particularly focus on the treatments that, in my experience in the last 12 months, I've seen a massive rise in. And two of my lovely patients have been kind enough as well to share their journey with these particular treatments. So I thank them too. But really exciting space, eczema at the moment. There's a lot of new developments, new treatments. It once was a condition that we as dermatologists really struggled to manage. We didn't have the landscape that psoriasis definitely did, but I think that the future is very bright. So just a bit of the background pathophysiology on eczema and why do we bother treating eczema or atopic dermatitis as it's known medically. And I think you really have to go back to the genetics and the underlying abnormalities to understand what we're trying to achieve when we treat this condition. And it all really does evolve from generally a genetic problem in the top skin layers. So there's a protein called filaggrin, which is coded for in our DNA. And in eczema sufferers, that protein is mismatch coded. So sometimes it's not there at all. And that's often the patients we have in hospital quite a lot with very unwell skin. And sometimes it's just slightly not quite right. And that's often the patients that don't even know they have eczema until they're well into their 30s, 40s, even 80s I've had recently. And it starts to bother them when the perfect storm of environment and stress and sweat wears away at their skin and their skin barrier becomes so disrupted that they do start breaking out in their eczema. So it does have a very definite pathophysiology basis to it, eczema, and a lot of our treatments today are really proving why they work because they're focused at correcting these deficits. So often when I'm talking to patients that are newly diagnosed or parents with kids that are newly diagnosed, I like to talk about this brick wall analogy because I think, I don't know if you can tell here in my background, but I've got a brick wall around me, so it's quite useful to show. But if you can imagine the skin as a brick wall, and good skin barrier really relies on quite an even, nice placement of bricks with an even distribution of mortar between those bricks, and then the stacking in quite an orderly distribution. So what we see happen in eczema is, if you can imagine that mortar, the glue that sticks the bricks together, as the filaggrin, that glue is a bit dysfunctional. It's not sticky enough, it doesn't hold well, and so the bricks do become quite uneven. They don't stick together nicely, and they become a dilapidated and quite disastrous and oftentimes barrier to anything, to any skin irritant, to wind, to sand, to salt, to chlorine, and that is what really wears away at the skin. And that phenotypically then presents as roughness, as redness, as irritation, and symptomatically to the patient is itchy and irritable. So I think it's just a good way to conceptualize how the skin is working, but also to understand how we're trying to build that brick wall up again, which is quite a multifaceted approach to get an even non-dilapidated, not falling apart skin barrier again. So just very broadly speaking, and I have shortened this today. Apologies again that I can't stay for too long, but the treatment ladder in eczema is expanding, I think, which is exciting. And we're getting more and more therapies available to us. But I think underpinning all of these therapies, and really important to me, is that you need to understand how to build that wall up regardless of what you're using. So even though we've got more and more topical therapies, we've got phototherapy, we've got oral therapies, and now we've got injectable therapies available, that first step of using a good skin hygiene routine, having an ability to cleanse the skin with a product that is going to help and not irritate or tear down the brick wall, and have a regular moisturizing regime, regardless of whatever treatment I put my patients on, I really do make sure that that is in place first, because I think having a solid foundation for your skin hygiene plan is so important in carrying you through whatever treatment modality you end up persevering with. So I'm going to speak very briefly on some topical therapies, and particularly some newer ones that have come to light in the last 12 months. I'm not going to touch too much on phototherapy, but that is an option for particularly quite erythrosquamous or psoriatic type eczema. I'm going to talk briefly on an oral therapy that's become PBS listed recently, and that one of my patients is having a fabulous result with. And also a bit more back onto the injectable therapies that are around now, and one of my other patients has offered to give her account of how this injection has really been a game changer for her eczema. As with any treatment, and any patient, I think it's really important also to individualize the plan according to the age, the interests, the sporting habits, the work environment of the patient. So it really isn't a one approach fits all in eczema. I often give my patients this sort of framework that, look, we're aiming to get your skin healthy and into the green zone. If you feel like it's going into the yellow zone, this is what I'd like you to do. And if you're going into the red zone, I show them what that looks like and how to contact. So that's just sort of a broad stroke idea of how I manage eczema on a day-to-day basis. I think it's really important, particularly when patients are starting out, and particularly when it's parents with young kids, that they have sort of goalposts of where they need to get to and what they need to achieve, and setting realistic goals, I think, in the first consultation with them is important, because it is a long game. Eczema is a chronic disease. It's not something we can turn off overnight. Well, these treatments are getting better and better at doing that, but I think it is important to really set realistic expectations with eczema. So starting with topical therapies briefly, and in the last 12 months, it's been quite a dynamic field as well, but the Atopic Dermatitis Work Group, that's a US-based organisation, they've set out a guideline recently on how best to treat adults with eczema. It was published in AAD and some of the American journals, and really strong recommendations. So they went through and put strengths of recommendations. So I'm just focusing on the strong ones today. So they really endorsed these following 5 treatments. So moisturizers, as we've talked about, are really underpin any treatment modality, but also topical calcineurin inhibitors. So they're things like pimecrolimus and tacrolimus, which have a good long-term inflammatory drive reduction. Topical corticosteroids are still up there as the mainstay of topical treatments, and first line in the US and in Australia. They help to relieve itching, decrease inflammation, and also reduce infection rate. So the new kids on the block are the phosphodiesterase 4 inhibitors, so crisabolate ointment, which is in Australia but is still very expensive. And that's been shown to help reduce inflammation, help itching, and decrease infections, and also the JAK kinase inhibitors. So we don't have access to this agent at the moment, but in America it's getting more and more traction, and it's showing a lot of benefit and perhaps less reliance on the topical corticosteroids, particularly in younger patients. So that's really an exciting space to watch. The oral therapies that are quite the older traditional agents and still tried and tested, and we do use a lot, azathioprine, methotrexate, and cyclosporin. But the exciting newer options I was going to focus on today. So I'll start you with Rinvoq, or ubetasitinib. So this was PBS listed here in Australia on the 1st of February last year, 2022. And it was for adults and adolescents 12 years and older with quite severe atopic dermatitis. So that's established by an appointment with someone like me who grades the eczema according to an EASY score out of 72. And there's a set threshold number that patients need to reach so that they are deemed by PBS to be eligible for this drug. So this is a tablet. It comes in two forms, a 15 and a 30 milligrams, and the dose is 15 to 30 milligrams daily. It's working, if you can think back to my first slide on that pathophysiology, it's working at that JAK kinase level, so the cytokine level, to disrupt the signaling cascade that really drives that brick wall disruption. It does have a few side effects. So is an increased rate of herpes zoster, herpes simplex, acne, and folliculitis. But in my experience with this drug, and it's still, I have not used it as extensively as dupilumab, but all my patients have done exceedingly well. This is one of my patients that absolutely loves this drug. She is a fashion designer and was previously, you can see from her photo on the left, that was before she started treatment. And that, believe it or not, was after a lot of topical corticosteroids. So she was constantly using ointments, creams. We weren't getting on top of her eczema. It was driving her crazy in terms of her clothing and limiting what she could wear because she was finding the ointments so greasy and so lifestyle limiting. We talked about starting dupilumab, which was the injection. She was very needle phobic and just could not get her head around self-injecting every fortnight. So she elected to try Rinvoq instead. And within 8 weeks of taking this tablet, she had a complete life change. She is now happily wearing makeup where she wasn't able to before. She's well back into her career as a fashion designer. She now is wearing clothing and enjoying wearing clothing that she couldn't previously wear. So I think this medication has really changed her life and enabled a return to normal function that she, prior to Rinvoq, was really struggling with. So the injectable therapies have probably had a bit more use in Australia since they were PBS listed, just a bit earlier than Rinvoq, so 1st of March 2021. So dupilumab was marketed for treatment of patients 12 years and above, so the same sort of indication as Rinvoq with severe atopic dermatitis, again using that treatment grading scale that we talked about. This one comes in 200 milligram or 300 milligrams injections, depending on the body surface area affected of the eczema. And it's a second weekly injection that patients need to have. So the company that markets this are very good at providing support with injections, and they provide that through FaceTime or in person to help teach the patient to self-inject. And that's something that's done fortnightly until we deem that the skin is controlled enough that we can start increasing the dosing interval. And I'm just at that point now with a lot of my patients. So a lot of them have started in 2021. They're now 2 years into treatment. Their skin has been perfect for 1 to 2 years now. And I'm starting to talk about, hey, how about we think about reducing the use of this? And a lot of them are very reluctant because they're just loving having great skin. The way this is working is blocking IL-4 and IL-13, which are two of the cytokines that really drive the eczema inflammatory disease process in the upper layers of the skin. What is really fabulous about this drug is that it does not suppress the immune system. So it doesn't need the blood monitoring that we're used to doing as dermatologists with things like azathioprine and methotrexate. So it takes a bit of stress out of us because whenever we start people on those drugs, we worry about how that's going to affect the immune system, but this one doesn't do that. So it's a massive plus. There are side effects. I've been lucky enough that one of my patients has had the eye side effects, but really nothing else, and definitely nothing that's limited their treatment with this drug. So an absolute game changer for eczema. It's really given people their life back through enabling their skin to heal properly and reform that brick wall that just hasn't been able to do with topical treatments. So Betsy, I think we had a little video from one of my patients on dupilumab. This patient particularly had struggled with facial eczema and a lot of swelling and discomfort that was preventing sleep. She had a lifelong history of this by the time I met her in her 50s. She was completely overusing topical corticosteroid, and so she was very keen when this drug was PBS listed. So this video is probably a year, 2 years old now even. What I remember particularly with her was when she started the injection, she came back to see me 3-4 months having done the fortnightly injections, and she was in tears just saying that she, for the first time in her life, she did not feel itchy, and that I couldn't understand. She was trying to explain to me how significant that was for her and how she no longer woke up at night scratching or felt that need to scratch. And for her, that had really been a complete game changer. So yeah, really exciting space. I'm sorry to leave you early. Happy to answer any emails later tonight or maybe tomorrow if Betsy can pass them on, but have a fabulous webinar. Thank you so much for having me.
Thank you so much for that, Dr. D'Ambrosio. Today, we'd now like to introduce you to our next speaker, which is EAA and EANZ President Cheryl Tallant. So I'll now hand over to Cheryl.
Hi, everybody. Thanks so much for joining us today. And thanks, Dr. Kate, for that wonderful presentation showing us the wonderful advances in treatments that we can now access for our eczema patients. At Eczema Association, we really like to provide that information for our patients that contact us. So the Eczema Association of Australasia and the Eczema... So our role as patient support groups for the Eczema Association of Australasia and the Eczema Association of New Zealand is to provide support and education for eczema sufferers and their carers, along with the wider community, so that's everybody, in all aspects of eczema and its impact. As you know, it doesn't just impact the sufferer, it also impacts the carers of the sufferer and their families. So we really like to try and help people navigate through all the different aspects of eczema that you are facing when you get that diagnosis or your child gets that diagnosis, which is very depressing. So the EAA and EANZ are non-profit organisations, incorporated bodies, registered charities, we have PBS status and a medical advisory board, of whom Dr. Kate, you just listened to, is one of, and a great help to us. We are not medical people, so we rely on our medical advisory board for all those sorts of questions that we might get asked. And we have international links. Every year, the EAA and EANZ run 2 awareness campaigns. The whole of May is Eczema Awareness Month, and we try to really bring our plight, the plight of eczema sufferers, to the attention of the public. In this way, we can access more resources, get to those bodies that may not know about us, and it provides a great platform for advocacy for all the new treatments that are coming on board. It's very exciting in the eczema space. There's a lot of new stuff happening, but we need to have access to it. So this varies all around the world. So in September now, which we used to run on the 1st of September as Eczema Awareness Day, we now run World Atopic Eczema Day, and it's run as a worldwide event, which is very exciting. So we're proud members of the International Alliance of Dermatology Patient Organisations, which is Global Skin. In fact, I was an executive board member, and it's just amazing the types of programs they're running and the events they're holding to really make atopic dermatitis, or atopic eczema, as we like to call it, first and foremost in people's minds. We also work with some other organisations, local and global. We produce and distribute lots of information for our patients and for the wider public. So we have information sheets on lots of specific types of eczema, treatment plans, all sorts of things that people with eczema want to know. We have our own eczema care plan, which is a little bit different to Dr. Kate's, but it's very helpful. You can take it from your pharmacy to your doctor. And we put out posters and brochures just to give people who are often quite frightened when they're newly diagnosed with eczema, a bit of a pathway and a bit of an overview of what they're probably going to be dealing with, but also to offer some help that there is management available. We know there's no cure, but people can manage their eczema very well. We also produce the only dedicated magazine in Australia and New Zealand for eczema sufferers. And we include recipes and lots of articles, and it really makes people with eczema feel as though they're not yelling out on their own and they're not battling on their own so much. Give us a call, visit our website, send us an email, and we'll let you know all the details about how to access all these wonderful resources. We're here to help you. So Dr. Kate went over the treatments available in Australia. So we know that there's a big difference between eczema sufferers. There's mild to moderate sufferers, and then there's the more severe sufferers. So for mild to moderate treatments, we have topical steroids, still a mainstay, been around for many years. A lot of steroid phobia, which we try to address with lots of articles and talking to people. There's topical immunosuppressants, so some of the creams that Dr. Kate showed you in her presentation. Topical biologics, so these are the new kids on the block, but also the traditional treatments like antibiotics for infection, bleach bars and wet wrapping, which we know are the mainstay of most people's eczema regime. It's all about managing it well, and these are the things that you'd be looking at. The systemic treatments, so these are for the more severe sufferers. Stronger topical steroids, topical immunosuppressant creams, light therapy, immunosuppressant medications such as Rinvoq or Dupixent, such as cyclosporin, biologic medications such as Dupixent, and again, often antibiotics for infection. So we know that maintenance pretty much across the whole world is the same. So often it's helpful to have allergy testing. Look at your cleansers, look at the products you use, soap-free, avoid fragrance, avoid known allergens if you have any. The allergy testing won't actually help clear up your eczema, but it does help you with a tool to try and avoid things that you can have a reaction to. So it's really useful for a lot of people with eczema. And of course, moisturizers or emollients are your mainstay. Doesn't matter how your eczema is looking, what stage it's at, this is really the basis of your management plan. Also, sensitive choice household products. We know people react to a lot of things around the house. And diet elimination. So you can do that yourself. You can do your own type of diet elimination, keep a diary, write down what you've eaten, and often over a few months you see a pattern emerging. So that's just a really good tool to help you manage your eczema. The other thing is stress management. We know that stress doesn't cause eczema, but it definitely can exacerbate a flare. So it's very important to try and reduce that stress. Unfortunately, the disease causes its own stress, so it can be quite difficult to navigate. There's also natural therapies. So some people go down the path of Chinese medicine, naturopathy, and there's many people that have great results with these. But unfortunately with eczema, there's no one size fits all. So probiotics, vitamin supplements, many people try all these different things and they work very well for some people. But unfortunately, there's no one thing that we can say, yes, do this and it will give you better management. It's really trial and error, and that's the frustrating thing about eczema. So, even sufferers who are long-term sufferers and have their eczema pretty much under control, you can never really relax. You can always have a flare-up, and it really affects your self-esteem. You sort of get that sinking feeling, oh, here we go again. So a lot of people find that getting support from a psychologist or someone that can help you with a mental health plan can really help relieve your short-term stress, even if you only access them short-term. A psychologist, for example, can give you some strategies to help cope with the itch. Because we know a lot of people with eczema don't have severe eczema, they have mild eczema, but they still get incredibly itchy. So they really need to find ways to manage their eczema flare-up much more effectively. If you're experiencing symptoms of depression, which having eczema causes in itself, it's always good to reach out for support. So take the first step by going to see your GP or a dermatologist. We always recommend that a dermatologist should be consulted if you have eczema, and do a review every year. But they can help you with support and services to help you manage your skin better. Also, get in touch with us. We're here to help as well. Thank you very much, everyone, for listening. And don't forget, we're always here to help you if you need us. We're accessible via phone or email or through social media. Thanks for listening and enjoy the rest of the webinar. Bye for now.
Thank you so much for your insights, Cheryl. That was wonderful. I will now hand over to our EANZ representative, Vanessa Jenkins.
Hi everyone, nice to see you all. So the EAA and the EANZ, like they were saying before, is a not-for-profit organisation. We offer support and education around eczema. I'm the carer to my husband Reese, who you'll meet soon. So yeah, the EANZ offers support through the phone and email, like Cheryl said. We are one of the only ones in New Zealand that offer eczema support. So please feel free to reach out to us anytime that you need a hand. We've got some great information sheets that we can send out to you and all of that sort of thing. So the treatments that are available in New Zealand, we're a little bit behind the ball with a lot of things. For the mild to moderate eczema treatments, as well as the severe sufferers as well, topical steroids are generally what's used. Immunosuppressants such as cyclosporin and methotrexate can often be a default. Antibiotics are generally used to stop infections. Bleach baths, wet wrapping, that sort of thing is quite common in how we treat the eczema in New Zealand. We don't have the bio ones that Australia and a lot of the other countries around the world have. We're working really hard at the moment to get them in New Zealand, approved and funded. So that's been our job in the last little while, is to get those pushed through. We do have access to things like light therapy, the immunosuppressant medication and steroids and things, but like they said before, it's more about management than actual treatment at the moment, and we're working really hard to get that sorted. Next slide, please, Betsy. So carer tips. I've been a carer for Reese for quite some time now, and the biggest tip that I would have for people is be kind to yourself. Eczema has a ripple effect, and it doesn't just affect the sufferer, it also affects family members and those close to the eczema patient. So it's really about being kind to yourself, making sure that you are looking after your own mental health. If we fall apart, everybody else falls apart too. So it's really important that you take time to really build up your own stability, make sure that your balance is there so that you're able to give the person that you're caring for and your family the best of yourself. Depression is a really major thing that impacts eczema sufferers, but can also affect the carer as well. So being aware that your mental health is something that is going to fluctuate is really important to be aware of, and to seek help if you're in that position. So let us support you. If you'd like to reach out to us, we're available through phone and email. Head to our website, there's a huge amount of resources on there, lots of tips and tricks and all that sort of thing as well. You can find all our details on our website and on the screen. So thank you everybody. Please feel free to reach out anytime. It'd be great to hear from you. Thanks, Betsy.
Thank you so much, Vanessa. That was wonderful. We will now hand over to our eczema warrior, Reese Jenkins.
My name's Reese Jenkins. I'd like to thank Cheryl, Dr. Kate, Betsy and Vanessa. They do amazing work, and the information Dr. Kate put across there was a good analogy of how the skin works and how it doesn't work when you've got eczema. I've got a question here. What impact has eczema had on your life? So I've had severe atopic eczema for 33 years of my life. I'm 46 now. So I've had a long time of living with it. The main effect it has is effect of loneliness, I suppose. Missed opportunities in life, such as work opportunities, different careers I've missed out on because of my skin. and then things like day-to-day things that are a little bit more simple, like such as swimming in a pool with chlorine or in the ocean, exercising, so sweating hurts my skin. It affects my skin quite a lot, so I don't necessarily exercise as much as I should do. Little things like that affects your life quite a lot. The little things that other people don't see and don't think about. Other things that have impacted my life is the quality of life. Yeah, you know, your life isn't the best at times, you know, with depression and mental health issues. Being an itchy and annoyed and flared and in pain most of the time, you don't really look forward to life like other people do, I believe. The next question I've got is, what kind of difference would it make to people if they had access to long-term treatments for eczema? I believe that Dr. Kate showed the slide of her patient and how she came back after 8 weeks or so and could not express how much it had changed her life. And I understand that. I have had that experience. To get your life back and to be normal is an unbelievable thing to happen. It's almost a miracle for some people with eczema. If you don't need to wake up in the morning with blood on your sheets or wake up at night itching and not being able to sleep, you don't know how amazing it is not to be able to feel the itch and just relax and just be normal. To do with that question as well is just everyday things, going to work, being able to be in the outdoors, go out in the sun, little things like take your kid for a walk or a bike ride. These treatments work that miraculously to help people get their lives back. And the last question I've got here is, can you tell us about your experience while on medical trials with eczema? And I can tell you guys that I have been privileged to be on 2 trials now. The first trial I went on was 2015. That was for Dupilumab or Dupixent, and that was amazing. Yeah, that was a worldwide trial, so double blind. I didn't know if I was on it or not, but within 2 months, my skin started to change and heal. I lost the itch. That was quite evident at the beginning of the trial. I wasn't itching anymore, and that was a massive thing for me to be able to not have that irritant day in, day out in your life is so life-changing. I was able to hold down a job. This trial lasted quite a long time. It was a worldwide trial, so it lasted for 4 years. And unfortunately, at the end of that trial, I was not being able to get Dupixent through Compassion. So that was a bit of a bummer. It really sucked. Probably 4 months, 2 months later, my eczema started to flare again, and you really didn't know how good you had it, really. Some people say you don't remember pain after a while, so you don't remember itch either. Once it's gone, you can't really remember it. When it comes back, you remember it. Yeah. And then earlier this year, the second trial I've been on is for Rinvoq. As Dr. Kate had mentioned, that Rinvoq's in Australia. It's available in New Zealand at the moment for people with rheumatoid arthritis. We're still aiming for it to be able for eczema sufferers to be able to get Rinvoq here in New Zealand as well. And I've only been on it for 5 months now, so I believe I'm nearly at the end of the trial. Next month is the end of the trial, so hopefully I'll get it through Compassion, and it will continue to help heal my skin and stop the itch. One thing I've found with Rinvoq is definitely stop the itch is the biggest thing. And for everybody out there with eczema, understand if you didn't have the itch, it would make it 95% better. So thank you very much.
Thank you so much for sharing your story, Reese. We really appreciate your courage in sharing your struggles with us. So thank you for taking the time to be on the webinar today and share some insights of what your life looks like with eczema. Thank you for your insights today for everybody on the panel, Cheryl, Vanessa, Reese, and Dr. D'Ambrosis. I, for one, certainly learned something new today from your incredible insights. I'm sure the attendees today are burning to ask a couple of questions, so we might jump into the Q&A session now. To start with, we've had a couple of questions from registrants who weren't able to join, so we will go through these first and then jump into some great questions that people have been wanting to ask throughout the session. First of all, I might ask the panel to pop their cameras on and turn their microphones on so they can jump on in when necessary. Cheryl, I might direct this question straight to you. Why do you think topical steroids have a bad rap with eczema sufferers?
Unfortunately, topical steroids, which have been around for many years, although they've been around for many years and years ago, they were really not used correctly. We know these days they have a really important role still to play in the management of eczema, but we use them quite differently. Short-term bursts, and we have a break in between for the skin to recover. There have been reported, there's not a lot of evidence yet, but a lot of people have reported having topical steroid withdrawal. It's a very specific type of reaction to a topical steroid, and often it's because these topical steroids have been used for many, many years from childhood, very strong ones, overused over many years. But we're still looking into all the reasons. But for most eczema sufferers, myself included, using a topical steroid for a short-term amount of time to manage a flare is very, very helpful. I mean, there's a big difference between the mild, moderate and severe sufferers. And I know many mild to moderate sufferers like myself that rely on moisturisers and stress management and all that sort of thing, but every so often have a bad flare and need to use a topical steroid. And they're very, very useful. Doctors report that actually they're underused these days in most countries, but they are still a great tried and tested tool that work for many, many people. So don't be frightened. Get some more information about using a topical steroid and go ahead and use it. It's really amazing the results they can still produce.
That's great. Thank you, Cheryl. I've just got one follow-up question. What are some of the most common treatment-related questions you receive from eczema sufferers who call through to the EAA?
Well, topical steroids is the number one on the list, and we talk about this all the time. It's one of the things we produce a lot of educational sheets about because it's an ongoing problem. People often get topical steroids confused with the anabolic steroids that like athletes and that may take to enhance their body, and they're quite different. But we know used correctly, they're a really safe treatment for eczema sufferers and can really help reduce the inflammation on the skin, and this in turn reduces the itching. So it really helps to manage a flare. But, you know, with eczema, it's not just a one factor treatment that you'll use. It's a range of different things. You've got to look at the products you're using. You've got to make sure you're moisturising to repair that skin barrier, and use your topical steroid when necessary. Again, the most often asked question.
Yeah, that's so interesting. Vanessa, feel free, and Reese, feel free to jump in if you have anything else to add to any of these questions. Vanessa, I might throw to you here. What has been the hardest part of being an eczema carer?
Maintaining balance, I think, has been quite difficult. We've got kids, so, you know, as well as running a household and working and all of that kind of thing. I think the most difficult thing has been to make sure that Reese has had everything that he's needed in terms of support, what he's needed for his skin, mental health, all of those factors. And then having to remember that I've got those that need to be addressed as well. So I think that's been the biggest thing over the journey that we've been on the last 15 years. There's been a lot of learning that's taken place, definitely growing up a lot and learned a lot along the way. And, you know, sort of with that comes, you know, wisdom on how to deal with particular situations and things like that. But I really think, you know, maintaining the balance is definitely probably the hardest factor.
And can I jump in here and just add, please? It's wonderful the advocacy work that Vanessa and Reese are doing, because it really highlights what treatments are available in Australia and not yet available in New Zealand. And we need New Zealand sufferers to have access to these treatments. So that's why the work they're doing with the company around the Rinvoq medication and the advocacy, we're doing all sorts of things at the moment in New Zealand. to try and get access to some treatments that we know in Australia have made such a difference to severe eczema sufferers. So well done, Vanessa and Reese, for putting that effort in, and congratulations. So keep up the good work.
Thank you, Cheryl.
Thank you.
And well done to you, Cheryl. You're a warrior as well.
Thank you. So the second most frequent question the Eczema Association is asked is about moisturisers and what ones work. There's no one size that fits all, but we always encourage people to try anything they come across. Patch test it first, because everyone's skin's different. So what works for them may not work for the next person, but don't give up. Just keep trying different things. There's so many wonderful products out there available now for people with specialised skin conditions, but you're sure to find something if you just keep plugging away. And, you know, that's why we appreciate all our corporate supporters and samples they send us that we can send out to our members. It's a great way to try things without spending a fortune. So, you know, just keep trying things. Don't give up.
Thanks, Cheryl. That's fantastic. Vanessa, just jumping back to you quickly, what are the goals for the EANZ in 2024?
Oh, that's a good question. So we've got quite a few things on the cards at the moment. We're going to be rolling out a survey that basically we're finding at the moment that New Zealand's got no data. We are a little bit behind in the 8 ball in terms of, you know, what's available. And one of the factors is that there's no tangible data for eczema and New Zealand specifically. There's a lot on eczema and allergies. There's a lot on eczema and other comorbidities, but there's nothing specific for eczema and New Zealand patients. So we're really working quite hard to get that data, which basically is going to support the submissions that we're making to Pharmac for funding and for approval of drugs like Rinvoq and Dupixent that aren't in New Zealand yet. So the survey is going to be rolled out in the next week or so. So keep a lookout for that, guys. That's going to be on our website. Hopefully going to be able to roll that out to our members, and anybody who's got eczema or who cares for somebody with eczema, we'd really love to hear from you and have you fill out the survey. It's really about getting some really tangible information that we can use to support those submissions and to really kind of understand what it is that New Zealand and the community really needs in terms of treatments, access to dermatologists and things like that. And we've got a few things on the horizon. We're looking to put on a few events. We're going to be at a few of the baby expos next year, so come and check us out there. Yeah, and really we're all about support and education, so that's going to be our main focus for next year as well.
Fantastic. Thanks so much for that, Vanessa. And Reese, just another question for you. Thank you again for sharing your story. What are your tips to make yourself feel somewhat normal when you're an eczema sufferer?
I don't know if I've got too many tips on that, because it's I suppose escapism is the biggie, eh? Sleep for me has been always an escape for me. You know, in my younger years, I would sleep a lot to not be able to feel, but I don't know. It's I say, yeah, your family. You know, having family and having a lovely wife now is an awesome reason to keep positive and keep going. But you know, a good book, computer game, anything, painting, you know, counting cards, playing poker, you know, it's anything that takes your mind off that, because after a while you could have 3 hours and you haven't really thought about it and you haven't itched, you know. Once you get reminded about it, you'll start itching again.
Thanks, Reese. And obviously you've got a fantastic carer there as well who
I have, yeah.
along the way.
I am very blessed, yep.
So that will be a wrap on our last webinar of the year. So thank you to everybody who registered and joined us today. Thank you also to our amazing panelists, Cheryl, Vanessa, Reese, and Dr. Kate D'Ambrosis, for offering up your time and providing some wonderful insights into eczema, different treatments and management options, the upcoming available treatments in New Zealand, and of course, incredible personal insights on managing this condition as well. Thank you again for joining, and enjoy the rest of your day and have a wonderful break over the festive season. Thank you.